Hello, my name is Paulo de Siqueira Guida. I am an obstetrician here from Brazil, and I am currently a professor at the University of Campinas. My objective in this video is to present the proposal of the VIVA study, Violence Impact and Victims Assistance in Adolescence. Our study wants to understand the impact of sexual violence among adolescent women in Brazil, and also understand how would be the impact of some interventions as adequate contraception, also psychological support, and the offer of therapeutic libraries in the context of sexual violence. In our country, unfortunately, the problem of sexual violence is a really prevalent problem, and I am currently working on our clinic of sexual violence where we attend women and adolescent girls who were victims of violence, of sexual violence, trying to prevent uh, pregnancies and also sexual infections. We also promote the follow-up of those women and girls through 6 months with psychological, psychiatrist, social service, and also nursing follow-up for the girls and women. And our results showed us that the impact of violence on anxiety and depression is really are really powerful for that women. So they are really upset and they are really they feel themselves denied due to those conditions. On the other hand, the offer of an specialized care for that women and those girls has the aim to reduce the consequence of the sexual violence. It's clear to us that those interventions will not erase that violence they suffered, but those interventions will mitigate and try to resignificate their lives from now on and try to put that women and those girls out of that violence condition. Well, to the specific aims of this proposal are to characterize adolescent victims of sexual violence who receive care at a specialized service center across different regions of Brazil, because we believe that the uh, prevalence and the characters must be different in the different Brazilian regions. As you must know, Brazil is a continental country, and the problems probably are different in the different regions. We also want to implement a support network focused on mitigating the social and psychological harm resulting from exposure to violence. We also want to evaluate short and long-term outcomes associated with a multidisciplinary support network intervention. And finally, we believe that a support to the VIVA study, the implementation of the VIVA study will allow us to establish a Brazilian surveillance network for sexual violence among adolescent victims. So I think that our proposal is in line with the objectives of this grant, because we want to understand a specific problem that affects many girls here in Brazil with a severe impact on mental health, and we also want to make a continuous work to allow that those services will be able to receive and provide treatment for those victims. As a research, we propose intervention study, and we propose to use a stepwise designing. In this strategy, the participating centers receive the proposed intervention at different times. Initially, all centers are in the control condition without intervention, And by the end of the study, all centers will be under intervention. It will allow us to understand the impact of the intervention on the results regarding sexual violence. A demographic, economic, and social characterization of the victims will be carried out alongside an assessments of the characters of the violence to which they were exposed. We also want to gather clinical data regarding the treatment that those women received, that those girls received, also to help us to understand how the national protocols regarding the topic are in fact implemented in the different regions of the country. During the follow-up, the victims will be assessed for mental health outcomes associated with their experience of violence to understand that we want to apply instruments to evaluate functioning, dysfunctioning, anxiety, depression, health perception, substance use, risk sexual behavior, and exposure to intimate partner violence. Uh, and it's essential, in our point of view, that the victims of sexual violence receive the best available care, addressing both not only clinical but also the psychological consequences of the trauma. So, in this intervention, we propose as an intervention that the adolescents receive follow-up during at least 45 days for serological testing, but in the psychological domain, the participants will attend for weekly psychotherapy sessions, and some social intervention will include activities such as reading, painting, and other forms of art therapy. So we believe that in our proposal, we want to gather the clinical aspects, the psychological aspects, and also the social aspects, trying to mitigate the consequence of the exposure to violence. We believe that the way we treat the patients who were victims of sexual violence here in our center at the University of Campinas can help them to mitigate the problem, but we believe that nowadays it is offered for a very small fraction of the victims of violence here in Brazil, and we believe that implementing the strategy in other centers, especially at least one center in each of the 5 big regions here in Brazil, will in the first provide us some evidence of the impact of the interventions that we are proposing, and also be a way to have more professionals that are able to increment the access to care after sexual violence here in Brazil, and also try to change health policies here in our country. So this is the axis of our proposal. I thank you for watching my video. Sorry about my English because this is not my native language, but I really am trying to convince you about the importance of our proposal. And of course, I thank you for your time.